As Rhode Island continues to roll out its vaccine, Target 12 dug deeper to find out where the most people have been vaccinated in the state so far.
We obtained and analyzed new data from the health department officials and uncovered a portion of these vaccines went out to state residents. And some neighborhoods with low rates of infections were vaccinated more than others. 12
News reporter Anita Buffoni has been pouring through the data. She joins us now with what she's uncovered and what members of the state's vaccine subcommittee say needs to be done. Anita.
Shannon and Mike, more residents in the affluent area of the east side of Providence received a first dose of the vaccine over those living in some of the hardest hit communities in the capital city. This disparity is something one of the members of the state's COVID-19 vaccine subcommittee calls unacceptable. A breakdown of new data shines light on how Rhode Island's vaccine rollout strategy of prioritizing the state's hardest hit neighborhoods is working in some areas while falling short in others. Central Falls has the highest rate of infection, and data shows it has the highest rate of vaccines across all zip codes with at least 10,000 residents. But residents of the east side of Providence, the least hard-hit zip code in that city, received more vaccine doses than residents in Olneyville, the West Side, and Silver Lake, the city's hardest-hit zip code.
I think that is the problem that we need to fix.
Dr. Pablo Rodriguez is on the state's COVID-19 vaccine subcommittee. At the last meeting, this disparity in Providence was discussed. Members said more than 50% of appointments at the first vaccine clinic in Providence were made by East Side residents.
And really the people who can most quickly access the internet or can most quickly advocate for themselves or and access that vaccine did so, and they did so rapidly.
Looking forward, Rodriguez says he's hopeful the state can focus more on getting the vaccine out more equitably.
We're going to be, definitely making a point of making sure that the clinics that are being developed, that are being assembled, are mostly in the places where the epidemic is really burning most intensely.
And the data also shows 12% of the total doses administered went to out-of-state residents working in the healthcare and emergency response fields in Rhode Island. But the health department explained now that they are focusing distributing vaccines based on age, the number of out-of-state doses should start to decrease. I'm Anita Buffoni, 12 News.
Anita, thank you. And Target 12 investigator Eli Sherman broke this story online. Right now on WPRI.com, you can dig deeper into the issue. You can also see Rhode Island's maps for COVID-19 infections per capita and first doses given per capita.
Target 12 analyzed CDC and Department of Health data, and as of this morning, it showed Rhode Island had 80,000 doses it had not yet administered. The state now ranks last in the country for percentage of the population vaccinated. Last week, the health department told us they were aiming to vaccinate those at higher risk and not necessarily focusing on speed. But Target 12 has uncovered data showing that a significant number of people vaccinated in Rhode Island so far don't actually live here. 12 News reporter Anita Buffoni continues our in-depth coverage. Anita?
Mike, thank you. A breakdown of new data shines light on how Rhode Island's vaccine rollout strategy of prioritizing the state's hardest hit neighborhoods is working in some areas while falling short in others. For the hardest hit community in Rhode Island, the small city of Central Falls, data shows it has the highest rate of vaccines across all zip codes with at least 10,000 residents. But residents of the more affluent East Side neighborhood in Providence, the least hard hit zip code in that city, received more vaccine doses than residents in the hard-hit neighborhoods of Olneyville, the West End, and Silver Lake. Dr. Pablo Rodriguez, a member of the state's COVID-19 vaccine subcommittee, says that disparity is unacceptable.
We need to make sure that those communities that don't have access to the internet, that don't have access to information like some other communities do, definitely get informed and get in line like everybody else.
Dr. Rodriguez says looking ahead, he wants state leaders to focus distribution efforts in a more equitable manner.
These, bumpy, starts are usually a call to action.
The data also found 12% of the total doses administered went to out-of-state residents working in healthcare and emergency response fields in Rhode Island.
And again, that goes back to our goal of making sure we have healthcare providers in place to provide care.
Rhode Island has moved beyond the occupation-based vaccinations to distributing vaccines based on age. The Department of Health says that change should reduce the number of out-of-state doses. Right now on our website, my colleague Eli Sherman has a full breakdown by zip code of where the most people have been getting vaccinated in Rhode Island. You can see Rhode Island's map for first doses given per capita, all of that on WPRI.com. I'm Anita Buffoni, 12 News.